Okay, everybody, thank you for coming in this evening and attending our seminar. Tonight's seminar is about how everything you've wanted to know about holistic healthcare. We'll go on to the next slide again. So tonight, a lot of people always ask us about questions about what does holistic mean. It's a buzzword that people use all the time, but the question is, what does it really mean? Because many people use the word holistic, but the question is, can you really deliver when it comes to the outcomes, the clinical outcomes? So we're going to be talking about that this evening. So, go ahead. To share with you first our practice mission statement: to provide the best in holistic health and life care, and our catalyzing statement is to inspire people to live thriving lives so they can be a beacon of hope for others. Next. So our home run formula is basically the holistic approach. There's 6 components that approach this effects. So the first is the structural component. The next is the biochemical component, electromagnetic frequencies, which is toxicity, and the toxic overload that we get exposed to, allergies and infections, and emotional stress. So we're going to be discussing that in detail tonight in terms of what components there are that actually, imagine these as buckets in your life. If your buckets are full, you will have pathologies and sicknesses in your body. If your buckets are empty, then your body will be healthy. So these are the principles that most people don't understand, because everybody's always looking for a quick fix or a symptom treatment, whether it be traditional or natural. You're still treating symptoms. The goal of health is not to treat symptoms, but to actually get your body to become healthy so the symptoms become unnecessary. So we always want to look at the nervous system and the primary cause of health and disease, because this is basically where everything begins. For those of you that have never seen this before, our anatomy is such that the brain lives up here. This is the spinal cord. The nerves exit through here and control all the organs and muscles and systems in the body. So when you have 100% communication between the brain cells, the energy, you have 100% communication with the cells, the tissues, and organs, then you have 100% function. So when the system is functioning the way it's supposed to, then you have 100% health. So the question is, what controls your body's function? We need to go ahead, Lane. You want to take over? Go ahead. So the question is, what controls your body's function? Because a lot of people, if you're going to understand the mechanism of how your body works, you need to know how it's functioning. So what's your name? Yeah.
Willow.
Willow, go. You can sit over there if you want there. So this way you're not twisting your neck around. Then is that all right? Is that a little better? You want to go sit next to her? No, that's sad. That's okay. So. So let's talk again. What controls your body's function? So according to Gray's Anatomy, the brain and nerve system coordinate the function of, what does it say? Everybody read that.
All tissues,
organs and systems in the body. And so if the brain and nerve system can coordinate the function of all tissues, organs, and systems in the body, who cares? Well, guess what the bottom line is? It's, what does it say?
relates the body to its environment.
Gray's Anatomy, right? That's what all the doctors study. It tells you that the body's able to then communicate with itself. If you have good communication, you have good experience in life and health, right? If you have miscommunication, then it doesn't function the way it's supposed to. So this is an example of the vertebrae. There's discs in between, and there are nerves that exit in between the vertebrae. When everything's in alignment, the nerves have proper function. However, what do you see here? What's going on?
Pinched.
Right? It's misaligned, right? It's out of alignment. What's it doing to the disc?
Pushing it.
It's squishing it, right? Exactly. And what's it doing to the nerve?
Pinching it.
It's pinching it. So what do you think, that's good or bad? Not good, right? So what happens then when these misalignments or subluxations in the spine happen, the communication between the brain cell, the energy in the body, is not able to get to the organs and tissues because of the misalignment. And then guess what happens to these organs, right? What happens to these over time? They don't function the way they're supposed to, and that's how people get sick. So instead of trying to fix these, we should also look here to be sure the communication is appropriate, right? So, anybody know what that is? I don't either. No, I didn't know what that is. So, this is an example of oscilloscope. You ever see those things on TV where somebody has their heart rate like beep, beep, beep? This is actually a measurement of the nerve. So, pretend this is a nerve. Everybody put your hand out like this, right? Pretend that's a nerve. Now put your pinky on top of it. So what that is, this is equal to 40 millimeters of mercury, or the weight of a dime, that puts pressure on the nerve. Guess what happens to the nerve function? Within 1 to 2 minutes, how many percent do you think the nerve function diminishes by? Give me a number.
10.
Keep going. 60%. So within 1 to 2 minutes, if you put pressure on the nerve, the body doesn't function the way it's supposed to. Is that good or bad? It's not good. But the thing is, you're not going to feel it because you're not going to have pain right away, right? Okay. So this is a study done back in 1921. There was a doctor by the name of Dr. what? What's his name?
Henry Windsor.
Henry Windsor. And he was a pathologist, meaning he studied people that were already dead. And he would take then whatever that person died of, that organ, and trace back the nerve to the spine. And guess what he found? That person, whatever that person died of, that nerve in the spine was irritated, and that the vertebrae actually had a lot of arthritis or degenerative disease, disc disease, and it also had a small curvature in the spine. So what's the equation here? If you damage the spine, you damage the nerves, you're going to damage your health, right? A spinal problem always leads to a health problem eventually if you don't assess it in the beginning. So basically, in the beginning, you're supposed to have optimal health and function. Your vertebrae become misaligned, the spinal biomechanics get altered. Your nerve system, what happens to the nerve system? It gets interfered with, then the body what? And then you lose your, and therefore the last thing happens is what? You get symptoms, you get weakness. What'd you say, Willa?
You die.
You die. Well, you know what? If that was true, it would be easy, but you don't. You just don't function right. Do you ever see like a dimmer switch? The switch doesn't go on and off. It just gets dimmer. So who wants to live a life that's a dim life? You don't want to do that. You want to live fully in the light. So that's what happens. You have all these symptoms, but guess what? A lot of people try to get rid of these symptoms. Does that mean you're healthy if you get rid of these symptoms? You're just not feeling, any symptoms. But the body still could be malfunctioning over time. So we're going to be discussing this evening exactly what components can create distortion in your system. This is called the NET chart. Emotions can actually affect your body's health. Did you know that? So in Chinese acupuncture, they've figured out, for example, the emotions in the gallbladder and liver meridian are anger and resentment, emotionally repressed, depressed, indecision, indecisive, irrationality, frustration, and aggression. If you have these emotions that are chronic, that are happening in your body, there's a possibility that these vertebrae are misaligned, but also these emotions are creating the vertebrae to be misaligned, and you have this vicious cycle going on and on. I discovered this when I was early in my practice. I would adjust people, and the adjustments wouldn't hold, the spinal adjustments. I would correct their spines, and the adjustments wouldn't hold. And I began to understand and discovered that when the emotions are overwhelming in your body, the adjustments would not hold. And so there's a way to correct that, and that's called neuroemotional technique. So we also use in our practice the laser, the cold laser, and the laser basically emits visible coherent light, it stimulates the body's capacity to produce energy, and it allows your body to heal really fast. Yeah, it does it by itself. Yeah. Go ahead, just do the arrow. Yeah, just touch the screen first here. Yeah, I think it does it by itself. So it reduces inflammation in your body, and it also allows the ranges of motion to return to the joint. So the body then can heal a lot faster. What other things the laser does, it also increases uptake of oxygen, white blood cell function, the axons and the neurons regenerate in the nerve cells, and it also helps with the lymphatic system. It increases production of energy in your body, and it also modulates cortisol levels, and which has an anti-inflammatory effect, and that's why we use that laser. And it really produces extraordinary clinical outcomes in the shortest amount of time with the least amount of expense. So the laser is another tool that we use in our practice when it comes to holistic care. So this is an example of also how we use the laser. It's called upregulation, where if you test muscles that are weak, many times those muscles are weak because the nerve system's not functioning well, but it's on a software level rather than the hardware level. So what we do is we introduce the laser, and then it turns on the switch in the body, and then the body begins to function the way it's supposed to. There's some things that we do what are called fascial movement taping. We can test the body in terms of, actually, can I borrow you? You all right? Is that all right? Yeah. Okay. All right. Turn towards that way. Now watch this. Right? Stand straight. Put your feet wide apart. Cross your arms, like this way. Look up there. Good. Look that way. Good. Ready? I'm going to push you over this way. Don't let me. Ready?
Okay.
Hold strong. Good. Pretty strong, right? I'm going to do the other way. Ready?
Yeah.
Hold. Can you see what's going on? Try really strong. Ready? See how you can't do that at all? Hold this there. Hold strong. Don't let me push you over. See the difference? Try again. Hold strong. Okay, so that's telling you there's something that's not balanced in your spine. Arms in front of you, hands together like this. Lock the elbows straight. Ready? Look straight ahead. Hold strong. Hold strong. And that's fine. And hold strong. And that's not fine. Hold again. And that's not fine. Do you understand?
Yeah.
So that is called fascial movement taping. So what we would do, we would put some kinesio tape on your spine, and it would actually make it stronger to turn on the nerves in that area. Okay? So thank you. So that's another thing that we do in the practice. And this is performance taping. This is a person that's getting ready to do CrossFit. So we can actually tape the muscles in the spine. So instead of the muscles and tendons and joints and ligaments absorbing all the tension that's abnormal, the tape will absorb it like a shock absorber. So that's another way we can help the body heal and also prevent it from getting injured. On the biochemical level, we also we do lab testing in our practice. And what we do is, instead of looking, when you go to your traditional doctor where they look at your blood and a certain range, and that is called the clinical range. What that means, it's an average range where it means you're just not sick, right? But it doesn't mean you're healthy. When we read the blood work, we look at it from this range to this range, which is a healthy range. And then what we do then, we pair that with any type of nutritional deficiencies to fix the blood in order for the body to be healthy. We also check for gut dysbiosis. We do stool sampling as well. Many people have bacteria, viruses, people have yeast in their systems, all types of different parasites, and that if you don't, because of the immune system being weak, if you don't allow the body to be healthy, and those parasites are going to suck the energy out of you, and you're never going to be healthy. So we can identify that as well. The cortisol levels in the body begin to fluctuate back and forth. Cortisol is actually a stress hormone. When your body gets overstressed, what happens, the cortisol initially goes up, but if you keep getting stressed over time, guess what happens to it? It starts to deplete and go down, and it affects all your hormones. It affects the different the thyroid, it affects the ovaries, the uterus, the prostate, it affects the pituitary gland. These are all endocrine glands that talk to each other. So when these become disturbed, when you have a high level stress, then we can also evaluate that using, guess what we use? What kind of testing? We use saliva testing. So you can actually measure that in your saliva. Again, hormonal imbalance could be a result of all these things, but it's a very complex system, but there's ways we can measure those things so we can get your body to be healthy. On the detoxification level, we also would do hair analysis. And what we do is actually a lot of the heavy metals that we accumulate from all the foods that we eat, the air that we breathe, the water that we drink, accumulates in our tissues. So by looking at the hair, that's one avenue of approach to evaluate if there's any metals in your body. They could be aluminum, lead, there could be mercury, there could be arsenic, all kinds of different metals that create abnormal distortion in the body. What we find clinically is that when your body is full of heavy metals, your system's immune system is always overstimulated because they don't belong there. And so the body's always fighting, becomes an autoimmune issue. For example, like rheumatoid arthritis, you can have all kinds of different inflammatory states in the body. To look for heavy metal toxicity, we also do what's called the urine toxic challenge. We measure the urine for 6 hours on day 1, and day 2 we then evaluate it by putting a chelating agent into your system and to see how many metals come out of your system. And then you can evaluate then if the body needs detoxification or not. The gut immunity is where 80% of your immune system lives. Did you know that? It's in your intestines. So if you don't eat well, if you're overstressed and your gut's not functioning properly, your immune system is going to be weak. What does the immune system control?
Whether you stay healthy or not.
Right. And what diseases can it protect you from, your immune system?
Pretty much all of them.
All of them, right, including the big C, which is the big cancer. So instead of trying to kill the cancer cell, if you keep your immune system healthy, then the body will take care of it on its own by balancing your system. We also use homeopathic remedies, which is natural remedies to help the body heal. And also we use dietary changes as well in order for the body to come back to balance. Okay. Again, so there's 6 components that we look at in terms of the formula here. So we have the structural over here. We have biochemical, electromagnetic frequencies, toxic overload we talked about, allergies and infections. By the way, the allergies and infections are usually a result of all these other components being out of balance. This is an autoimmune issue, and so again, instead of suppressing the immune system, we want to boost the body's health so the immune system can balance itself. So you don't want to stimulate or inhibit anything. Okay. So anybody read this article there? No, I'm just kidding. So let's get a close-up of this. This is this. It's out of balance. So now go forward there, Lane.
Go forward.
Yeah. Keep going. Yeah, there's the article right there. So this is a study back in 1975 by Dr. Ronald Perot. He's the chief of cancer prevention at New York Preventive Medicine Institute and the professor of medicine and environmental health at New York University. And what he found is he took 107 individuals that they put them under chiropractic care for 5 years, and they wanted to measure their immune response. So, and what he found then is he measured, for example, an enzyme in the body which is called glutathione transferase. It's an enzyme that if you have high levels of that, your body can actually have a higher level of immune response. He also measured what's called unscheduled DNA synthesis, meaning that if your body's DNA gets damaged, if your body's healthy, your body can repair the DNA, and then you end up not creating pathology in the system. There are 22 different parameters that he measured when it comes to immune response. He took 107 individuals that were under chiropractic care for correction of subluxation, not for pain, and he wanted to measure the immune system response in comparison to people with a clinical case of cancer. And then the control group were people that did not have cancer but did not get chiropractic care. And the interesting findings were that all these people were genetically normal, the people under chiropractic care, meaning there was nothing outside of the parameters that would make them less susceptible to cancer. So here's the outcome. Guess what they found? The cancer group had a certain immune response. The chiropractic group had 400% greater immune competence than the cancer group. And compared to the control group, they had 200% greater immune competence than the control group. And guess what? Back then they didn't know it, but this new study just came out last year in 2016 in March from University of Virginia. These scientists were looking at the immune system. They found that the central nervous system had a direct connection to the lymphatic immune system. They found all these cells in the lymphatic immune system that's never been discovered before. This just happened last year. And so now they find out that the immune system and the nervous system have direct link and communication with each other. And that's the reason why in holistic chiropractic care, we always make sure that your nervous system is balanced. Because if it's balanced, then that means there's a high likelihood that your immune system will also be healthy. Okay? So that's really what the holistic paradigm is all about, that you have many different components in your body that make up your health, and if you keep those things in balance, and then you stay healthy. So unfortunately, it's a heavy burden to me, because guess what? Before you even found out about this evening, you don't know about this, right? Not a lot of people know about this. Think about all the people out there that are suffering unnecessarily. They're trying different things, the suppressive therapies that actually get the body to be suppressed, to be stimulated or inhibited. And it doesn't really make the body healthy, right? So think about this. Medications are necessary for emergency care, right? But for chronic use, does anybody know what the meds do, medications do?
Do what they're supposed to prevent.
What's that? The mechanisms of how drugs work. You're not going to know it, so let me tell you. So what it does is it either poisons an enzyme in your body, or it blocks a receptor. Think about an antihistamine, right? So if you have histamines in the body because the immune system is challenged, it's overreacting to, let's say, pollen, so there's going to be histamine receptors in the cells. When the histamine docks on the receptors, you create inflammation in the system. That's why you get all swollen and so on. You get allergy symptoms. What an antihistamine does, you put a drug in the system, it blocks the receptor, so now the histamine can't dock. So can you see that? It's blocking a receptor. Some medications will actually poison an enzyme in the body, so then this way the body can't then do what it's supposed to do. Now for short-term use, that's okay, but for long-term use, how long can you block an enzyme and poison an enzyme and block a receptor before you become healthy? It's never going to happen, right? So drugs have their place, but it's only for temporary use. If you want to be truly healthy, you want to make the body healthy. And that's the thing that's a burden to me, because most people don't understand that. And I can't be everywhere, although we're trying to do this on social media now, to share with you this information about health, the truth about health that most people don't know about, that they need to know, that needs to be shared with them. And I implore everybody and support you in actually sharing that information as well, because there are many people that are suffering out there that are looking for answers that they don't understand, because they don't understand the principle of how the body works. So the worst that could happen is that you plant the seed, but they don't necessarily take action immediately. Don't let that discourage you. So the next action step, for those of you that are here as guests, we set 4 hours every week in our practice for proactive screening. So it's a thank you gift to you for being here this evening. For the potential new patients, our normal exam fee, which includes posture analysis, bilateral weight scales, functional movement analysis, a surface EMG of your spine, which uses a computer program. And also, if necessary, if you have any degenerative changes in the spine that are suspected, we can actually take x-rays too. The normal fee for the evaluation is $280. And tonight, this evening, we're offering it for you for $145, which is $135 savings if you register this evening. For those of you that are online, you can call in and give us the code HOLISTIC, and we'll know that you've watched this video, and we'll extend that savings to you as well. So just be proactive, before it's too late. Okay. So visit our website, drmariano.com, and mention the code HOLISTIC to receive the special seminar rate. And also like our Facebook page, Mariano Holistic Life Center on Facebook. so we can share with you pertinent information and health enhancing information as well that will help you be healthy throughout your life. Our next seminar is Learn How to Prevent Cancer and Heart Disease Naturally, and that's going to be next Tuesday at 6:30. So, you know what? Even though we don't get a yellow jersey at the end of our 3 weeks, like the Tour de France people do, we're just athletes just like those people are, because we get exposed to as many stresses, if not more, throughout our whole life. We have the opportunity to get your body to be healthy without having any side effects by doing the protocols that we have in our practice. So I encourage you to get involved and share this with people that you know. And thank you for being here this evening. We'll see you next Tuesday for our next seminar.